randomized feeding intervention in infants at high risk for celiac disease. Celiac disease, an immune-mediated systemic disorder elicited by gluten in genetically susceptible persons, is characterized by anti-transglutaminase type II antibodies (TJ2A) and enteropathy. The prevalence of celiac disease is 1 to 3% in the general population and approximately 10% among first-degree family members of patients with celiac disease. Celiac disease is treated with a gluten-free diet. More than 25% of patients have the HLA-DQ2 heterodimer either in the cis or trans configuration. Most of the remaining patients have the HLA-DQ8 heterodimer or half of the HLA-DQ2 heterodimer. This is a video that explains what is the celiac disease.
Celiac is a disease that affects the small intestine. It is a genetic disease, so people who have it are born with it. The small intestine is lined with villi, which absorb nutrients. Celiac causes the villi to be damaged, and the villi can't absorb the right nutrients. Some of the symptoms of celiac include abdominal cramps, dehydration, energy loss, fatigue, mouth sores, muscle cramping, dry skin, depression, mood changes, bone disease, iron deficiency anemia, and in children, slow development and weight loss or gain. Some people, however, have hardly any or no symptoms at all. Celiac is one of the most underdiagnosed diseases, so as doctors are becoming more aware of celiac, they diagnose celiac through a process. If the patient is experiencing some of the symptoms, doctors may perform a blood test. If the results of the blood test come back positive, the doctor may perform an intestinal biopsy, because a blood test is not completely reliable. During the biopsy, the patient is put under and the doctor eases a tube down the throat and stomach and into the small intestine. The doctor will then take a sample of the small intestine to test. This test will show whether the patient has celiac or not.
Celiac disease increases the overall risk of death. 15. Reduce quality of life. 16. And has extensive negative economic consequences. The health and quality of life of patients improve with a gluten-free diet, but primary prevention will be more beneficial.
Hey everybody, Joe Rignola here, and as you can see behind me, I've got what looks like a really complicated diagram, but I'm going to do my best to try and break this thing down for you. What this is a process from when you have something like a bagel with gluten in it, all the way through your digestive tract and into your immune system. I get asked this question a lot, and I explain this to my clients all the time. How is it that gluten can affect virtually every tissue in my body? And so this is the process that goes on. So I'm going to jump right in. So the first thing, let me describe the landscape of the gut a little bit. And the first thing you have to understand is that the inside of your digestive tract is actually the outside of your body. I know that doesn't sound right. It sounds a little counterintuitive. But think of your digestive tract, looking at this bagel here as an example. The whole of the bagel, the center of the bagel, is at the inside or the outside of the bagel. Well, of course, it's the outside of the bagel. The inside of the bagel is the actual inside of the bagel. So it's the same thing with your digestive tract. It's really the outside of your body. And you don't want things that belong outside your body to be inside your body. So we're going to travel right down to the small intestine, and we're going to zoom up on one little portion of the small intestine, and we're going to find these finger-like projections, or like a shell carpeting. And if you saw in my three-part video series, my free three-part video series where I talk about the mistakes people make when they go gluten-free, I talk about these villi a little bit. And these villi create a tremendous amount of surface area which allows you to absorb nutrients. Now the surface area is so great, if you were to flatten this small intestine out, flatten all these villi out, the surface area is great enough that you could cover a tennis court. And that, again, that allows you to absorb nutrients. Without that surface area, you struggle to absorb nutrients, and that's one of the main problems with celiac disease, is that these villi are gone, and you have almost no surface area there. So that's the villi. Now we're going to blow up just one small section of this villi, really big, and we're going to find this single layer of cells. These cells are called epithelial cells, and it's a single layer of cells. It's your mucosal barrier, and the job of this mucosal barrier is to absorb nutrients, very small single particle nutrients that your body can use to build muscle and nourish itself. But its other job is to keep anything else out. So undigested food and proteins and bacteria and other antigens, pathogens, fungus, all that stuff is supposed to stay outside of the body.
Continue with the presentation. Results from observational studies indicate that the development of oral tolerance for gluten is initiated earlier in life, and that the mode of introducing gluten to infants may influence the risk of celiac disease in predisposed persons. In conclusion, this randomized trial did not show the hypothesized benefit of early exposure to small quantities of gluten with regard to reducing the incidence of the celiac disease among children from high-risk families. So that is another video.
Hi, Dr. Osborne here to talk about gluten sensitivity. And I hope that by the end of this lecture you'll understand what gluten sensitivity is, what gluten is, what celiac disease is, and know the differences between them, and overall just have a better understanding of the topic. So the first question that we ask is, what is gluten? Gluten is a mixture of protein found in grain, and really two key words in this phrase here, and that is all grain, not just some grain, not just select grains, but gluten is found in all grain. And gluten is actually this generic term that we use. It's more specifically, gluten is made out of smaller pieces of proteins, and these are called prolamines and glutenins. Now, as you see here, there's a particular type of prolamine found in wheat, and it is called gliadin or gliadin. And this is the prolamine, or the piece of gluten, that is most associated with the development of celiac disease. Now I want to go to this diagram and show you a few things just so you can better understand grain and gluten and how they fit together. In this left-hand column you can see the name of the grain. In the center you can see the top here, it says prolamine. Well, remember, prolamine is a subfraction of gluten, so this is the name of the gluten found in the different grains. And in this far hand column you can see percent total protein. This is the percent of gluten based on the total amount of protein that's found in the particular grain. So for example, in terms of wheat, the gliadin in wheat consists of 69% of the total protein found in wheat. So there's a lot of gluten in wheat, and that's one of the reasons why wheat is typically the most detrimental of all the grains when we're talking about gluten sensitivity. Now you'll also see other grains here, and these first four, wheat, rye, oats, and barley, are your traditional celiac grains, but you can see I've listed a few other examples here: millet, corn, rice, and sorghum. And you can see they all have their own types of gluten, and they all have their own different concentrations of gluten as well. So what we've got here is we've got different grains containing different types of glutens and having different concentrations of those different types of glutens. As we go,
Thank you for your time.